I'm with Dr. William Breitbart, who is president of the Academy of Psychosomatic Medicine, and in real life he's chief of the psychiatric service at the Memorial Sloan Kettering Cancer Center in New York City. And you're in charge of a very interesting program this year on mind, body, spirit, and so forth. But the group, you're sort of mind-body doctors. Is that a fair way to define psychiatric or psychosomatic physicians?
Well,
mind-body doctors?
Well, first of all, thanks for inviting me.
You're welcome.
To the program.
It's our pleasure.
I've been watching you for a very long time, and it's a great privilege for me to be on your program. Well, actually, you know, the term psychosomatic has its origins in Greek roots, psyche and soma, mind and body. But the fact of the matter is that psyche, Greek goddess, was not so much the goddess of the mind, but rather the goddess of the soul. And in Greek philosophy, the soul is actually a combination of the mind and the spirit. Mm-hmm. And so really if you think about the roots of the term psychosomatic, it extends beyond physicians who deal with the body and the mind. It actually more accurately describes the physicians who deal with the mind, soul, spirit, and the body. Mm-hmm. And just to go a bit further, the Greek roots of the word psychiatrist are similar in terms of implying that the psychiatrist, in fact, is the doctor of the soul. Iatrogenic, or iatry, is the physician, and psyche refers to the soul. So all physicians, in fact, deal with the mind and the body and the spirit.
Well, that's the point I wanted to get to. Aren't all, given to current research, which indicates very strong ties between mind and body. I mean, the profession has intuitively known this for many, many years, but now there's a lot of research to document the fact that the two are interactive. That aren't all doctors mind-body doctors? Why do we need a specialist?
I think all doctors should be mind-body doctors,
but they're not.
But they're not.
Why?
And well, because I think doctors tend to focus on certain organ systems. When they specialize in, I'm actually a board-certified internist as well as a psychiatrist. Mm-hmm. And I can tell you that when I was training in medicine, I focused on the body and the heart and the blood pressure, and I didn't focus on the whole person because the demands of the job as a physician, medical practitioner, and internist really force you to focus and make priorities, and there aren't often opportunities or time to really address the patient as a whole patient. And then what you end up doing day in and day out becomes habit and becomes hard to break. And so I think in this age of specialization, people tend to forget the patient as a whole, and they have a much more narrow perspective that I think doesn't serve patients well. I think our field of psychosomatic medicine is necessary for a number of reasons, not only because it was important to provide clinical psychiatric care to medically ill patients, but also to develop a body of science, research, and clinical practice that focuses on what the actual interaction is of the mind and the body, how chronic or life-threatening illnesses affect people, individuals, and their families, what are some of the effective interventions. I think it's fair to say that psychosomatic medicine psychiatrists are, in fact, psychiatrists who focus more on the interface between psychiatry and medicine, as opposed to medical physicians who have a primary interest in the medical care of patients with a peripheral interest in how they're focusing, how they're adapting psychologically.
How about the rest of your psychiatric colleagues? Are they as in tune with the need to connect mind and body as psychosomatic psychiatrists?
I don't believe so. I think the way that most of our psychiatric colleagues are trained really de-emphasizes their exposure to people with serious medical illness, and as psychiatrists move further and further on in their training and past their basic psychiatric training, they become more and more removed from the medical hospital setting or medical ambulatory care setting, and they're dealing primarily with people who are not medically ill, or whose problems don't necessarily originate or are primarily focused on adapting to or coping with a medical illness. They're dealing with more major psychiatric illnesses like schizophrenia, bipolar disorder, or anxiety disorders, or interpersonal relationship problems, etc.
But so they're at one end of the spectrum, and the primary care physician is at the other, neither paying attention to the other side. Is that correct?
I believe so. I think there's a big gap in the middle. I think the fact of the matter is, your questions really imply the fact that all physicians should be able to provide comprehensive whole person care. And certainly there are not enough psychiatrists in a cancer setting to be able to provide all of the psychosocial or psychological care to patients. There are not enough psychosomatic medicine psychiatrists to provide all of the social or psychiatric care to everyone with any kind of medical illness. So it is critical for those of us who are specialists in these areas to develop the science, develop the clinical interventions, to show what's effective, to demonstrate what the problems are, and to try to educate our primary care colleagues, our medical colleagues, so that we can extend our work beyond the reach of those of us who are...
What evidence is there that attention to both mind and body in an integrated way produces a better treatment outcome?
Well, I think what is growing in terms of research is that paying attention not so much to just the mind-body interaction, but the mind-body and spirit interaction is demonstrating that paying attention to existential concerns of human beings, paying attention to such important concepts as hope and meaning and purpose in life, allows people to adapt better and to cope better with serious life-threatening illness.
Is that what you mean by, and this is the added dimension I think that you're bringing to the APM meeting this year, the mind-body and mind-body-spirit connection, yes, you're calling it. Can you define spirit a little further here?
Sure. I think probably spirit's a difficult term for many people to understand. It's sometimes thought of as referring to religion or religious beliefs. It's sometimes referred to as, it sometimes refers primarily to existential concerns. I would say that it encompasses, the term spirit or spirituality encompasses components both of existential issues and religious issues, and I sometimes think of it more as a construct that involves concepts of faith and meaning.
But they're not all necessarily the same.
Not all necessarily the same.
So you can have an unreligious person, a non-religious person who can still be concerned about his or her own spirituality.
Right. I think that I might define spirituality or a spiritual experience as any experience of a human being that a human being has trying to define their place in the universe. That is, I think, probably the most simple, basic way what spirituality is all about. Some of our basic questions as human beings are: where did we come from? What are we doing here? And where are we going? And if you're a human being engaged in trying to understand those questions, that's a spiritual endeavor.
Is spirituality universal among humans?
I would think so.
But are there different degrees of it to which it exhibits itself in human relationships?
I think that people vary in terms of their connectedness to these types of questions, and how much they allow themselves to explore these questions.